It's that time of the week when we answer your medical questions with the TriHealth doctor. We are joined today by primary care physician, Dr. Arina Gagwa. Thanks so much for being here, doctor.
Thank you for having me.
Okay, so the first question of the day is a very big topic sent to us from Laura in Cincinnati. She wanted to know about urinary tract infections. What are the symptoms of a urinary tract infection?
The symptoms of urinary tract infections, UTIs, are difficulty on urination, increased frequency, increased urgency, and lower abdominal pain.
And what are the treatment options there for UTIs?
Before I start discussion about the treatment options, I'd like to mention there are two types of UTIs, simple and complicated. Simple UTIs involve lower urinary tract and are confined to bladder, and they do not involve signs of systemic illness, such as body aches, fever, chills. Complicated UTIs may involve structures above the bladder, including the kidneys, and involve signs of systemic illness. And the treatment for simple and complicated UTIs are different. The treatment for simple UTIs includes antibiotic therapy for 3 to 5 days. The choice of antibiotic is determined by the provider, depending on patient's medical history and prior history of urinary tract infections.
And what kind of follow-up should patients expect?
If the patient is improving after the starting of the antibiotic therapy within 24 to 48 hours, the recommendation is to complete the prescribed therapy and to follow up with the provider on as needed basis. However, if a patient doesn't improve within 24, 48 hours or so, or symptoms get worse, then the provider may order more tests and be more aggressive with the antibiotic therapy until the test results are known.
Very useful information, doctor. Thank you so much for stopping by. So remember, the answers you hear from our TriHealth experts are just a good place to start. This is not a replacement for advice from your own doctor. Send us your medical questions and a TriHealth doctor will answer it live on the air next Tuesday. Just look for the link at wcpo.com/doc on call to submit your question. We will answer one question every Tuesday. We'll be right back.